Hello, sorry. The instructions kept interrupting you, so I missed some of your question. Can you just repeat your questions? Thank you.
Sure, sure. I was saying, as an entertainer, as a media personality, how important do you think the role of the media is in addressing this vaccine hesitancy? And in what way do you see, from your perspective, media partners doing this work?
Okay. Thank you. Good morning and good afternoon to everyone. Sorry I wasn't able to join earlier. I'm having, as Igwe said, some um, challenges with my internet, but I'm very happy to be here and to be able to contribute. I think that we have a very important role as media people, personalities, to contribute. I think that we are often the first line of for communication that people have, where they need information and then they come to us. So we have to be very careful about the way that that information is shared, and then we have to be very detailed about how much information is shared and that it is accurate. I think we have a very large role, and in our own case, I don't think we have utilized our position as much as we could. I just believe that there could have been more campaigns, there could have been more information, dedicated information to just clearing up people's fears and people's concerns about the vaccine. I don't think that enough has been done. I think we could have had a full campaign, with influencers, people that the public sort of respect their views, people in some, in some parts of government. And we could have had campaigns on television, on radio, talking about, every single thing, having opportunities to inform about what the, different vaccines are, answer questions about any concerns that people have the science really spelled out properly. And then also have people that, as I said, influencers and people that the public have great respect and regard for, coming out if they have had the vaccine to tell people, okay, this is my own experience. I've had the vaccine. These are the reasons why I had the vaccine. And I think that's really what we needed to do. I don't think enough has been done in Nigeria. I'm not sure about the rest of Africa, but certainly in Nigeria, I don't think that enough has been done. And I just fully believe that a campaign would have been, the way to go. I've seen some celebrities, some people in my space who have done a bit of, they've done a few PSAs talking to the public about, vaccines and how important it is to get them. But even then, I don't think that there have been enough, and in as many places as possible. I've seen it concentrated mainly on social media, but I'm not sure they went on to, regular media, the radio, and even going into communities to have that sort of engagement. So I think that that's what I would suggest we do, and that's what I think is lacking in, the communication that has gone out about, about the vaccines.
All right. One of the questions that are directed to you right now is, which influencers would you or people like to hear from? Is it entertainers? Is it sports leaders?
It's all of those people. It's entertainers, it's sports leaders, it's everyone. It's anyone that the public, sort of regards as someone of influence, someone that they would listen to, someone whose view they would really, like to hear, or they would definitely get behind. So it's any of all those people that they could, that we could be utilizing.
Well, why do you think the campaign is not taking off the way it should in Nigeria? I mean, you have a huge entertainment industry. Is it because people don't feel that, COVID is as rampant, or is not impacting enough people? Why do you think the campaigns are not taking off the way they should?
I think it's just that no one has actually gotten, sort of a full campaign organized. I'm not sure it's anything other than that. I think if someone said, okay, one of these agencies put their mind to, really coming up with a decent campaign, then it could be done. I'm sure a number of people would get behind it. I know of several that would. So I just think it's a case of it just hasn't been, organized in a large enough scale as it could be. I think that's really all that it is. Yeah.
Yeah. And do you hear, from your own circle, do you hear some of the rumors and misinformation people have about COVID, like the vaccine, like it's, it's a 5G, it's 666. I mean, there's so many conspiracy theories. Do you hear that within the community? Have you heard that from people around you?
Yeah, I mean, I've heard it from in terms of the community. I think I've heard it from a couple of people, but that was in the initial stages where people were very anxious and they were coming up with all of these theories. When the vaccines did arrive, I think another issue was that for the people who were informed, because a couple of people that I'd spoken to had actually done their research about, the different vaccines, the efficacy and all of that. Their other concern then became if we would be in a position to store the vaccines as we were required to, and if people were going to get them at the right time, so that because there were some vaccines that were coming and they had to be in almost sub-zero temperatures, and there are several issues that we face in Nigeria with electricity and all of that, and people were concerned that the vaccines would not be stored properly, and then if you got the vaccine, there would be this or that. So, and then of course there are the religious reasons why people don't want to get them. So I heard from different people, different groups, different sorts of concerns, but they have also changed. Some of those concerns have changed over time. As I said, initially, a lot of them were, the talk about implants and all of that with the vaccine. The AstraZeneca causing several problems for people. Then people who were already on the fence, and even some people who were not, were very concerned. I, for one, I took the AstraZeneca, and I was concerned after my first jab, and then I heard all of these rumors. And I just did a bit more reading, and I went back and did my second and then my booster. So for a few people, that is not their own experience. They became concerned about it and they held off. I know someone who just has done the one. So it's a variety of reasons that people have expressed about their, what has held them back.
Yeah. I mean, this has to be a concerted effort. I think, a lot of the commenters are saying, campaign should be led, obviously, by Ministry of Health. I think in many countries, that's how it is. Yes. But it should be in collaboration with the entertainment industry, Nollywood in Nigeria. And obviously, it's a concerted effort has to be done, I think, in all aspects. It crisscrosses within everybody. So Michael, let me come to you. And so you've traveled, you said 67 times during COVID, kudos to you, because I know a lot of people would not be doing that. I've traveled, since I've been vaccinated, even before vaccination with a mask on. But I know, having been in the hospitality industry myself for 20 years, I understand how devastating the impact of COVID has been, especially here in the US and also in the West. And can you tell us the impact that it had in Africa based on your travels there?
The impact of COVID in Africa, you say?
Yeah.
Okay, so let me answer first of all. Let me just address a question relative to campaigns from my perspective that I heard the previous speaker say. For me, compelling would be not LeBron James or someone like in the United States doing public service announcement, but a desk clerk or a wait staff person or security person, to me, someone that I know that I'm going to interact with. So I think while we look at these big name stars to do things, I think sometimes to have someone simplistic that I'm interacting with would be even more dominant in terms of an influence on others like them to carry the message of the importance of vaccination. So I just wanted to say that, make that comment. But, traveling to Africa, of course, COVID restrictions were in place. Social distancing requirements were in place. The airports themselves were profound in terms of the intricacies of getting into the country, proving vaccination status, et cetera. And that was a comfort level for me. Being vaccinated was a comfort level, and understanding that going through certain intricacies and complications to get into a country were important. But as I mentioned before, I think in order for us to begin to see people move massively around the world into countries like Africa, where tourism is very important, vaccination status is absolutely critical. You know, I also saw during the course of it, hygiene efforts. I mean, it's so more comforting to go into an airplane and know that I can lay my head back on the seat perhaps, because all of a sudden they're cleaning things more methodically and thoroughly, and hopefully that's something that continues, as well as what we saw in hotel rooms as well, the cleaning, you know, the hand sanitization efforts and hand sanitizers out there. These are things that I think will be best practices, as well as the education of communicable diseases of people going forward, so we're aware of how things happen and how things spread, particularly at the employee level.
So how, in your view, has the service sector or the hospitality sector changed in the long term, or these are just, you know, you think, you know, all of these new changes, the hygiene and all the protocols that they've put in place, is it temporary, or do you see this continuing in the parts of Africa that you've traveled?
Yeah, I think it's something that we'll see going forward. You know, Africa, which I noticed, is influenced by global brands. So there are many global brands in Africa that are synonymous, be it Africa, Europe or US, such as McDonald's and Marriott and other sorts of retail brands. And they've put in practice standards that I think that they have found will be something that people are even more comfortable with going forward. So I think what we've seen as a result of it, some standards in place that will be standards forever. People have a level, particularly when it comes to hygiene, that we are doing the best as we possibly can. Prior to COVID, it wasn't necessarily a focus. Post-COVID, which we'll get to, I believe, at some point, why would we go backwards?
You know, one of the comments that we see from Jolene is, I agree with Michael, it's better to use micro influencers. They have the ability to interact with their audience, and there is a certain level of trust, as opposed to a superstar who are unreachable and unable to interact with their audience. I think it takes both groups, in my view, and you can add to this, Michael. So I think, yes, we can have the superstars on one end because it's important, and there's a reason why they are called influencers. But I also think that the average person that you interact with every day, their stories and what they're telling also matters. Here's another comment that was given. Vaccine hesitancy is an important issue, but the concern in Africa is also the supply and logistics related to mass vaccination program. Absolutely. Making matters worse is the vaccine stockpiling in the West. No one is safe until we all are safe. This is absolutely true, and it happens in Africa. This is what we're seeing at a global scale. Anything you'd like to add on that?
Yeah, I absolutely agree. I absolutely agree. And, you know, as I have been looking and studying some of the efforts in terms of getting vaccinations to countries such as Africa, you know, particularly the frontline workers, it indicated healthcare workers and some hesitancy with healthcare workers, and it was dispersed a bit wider. But, you know, hospitality and tourism workers are frontline as well. You know, as we get out of the, what I call the pent up demand stage, and people want to go back to traveling, it's important that access to vaccination are given to those that they interact. I just saw the name of a desk agent that I interacted with in Africa